Good evening friends, you are most welcome to Think Eyes channel. Today we are going to discuss Practicing Anthropology, which is written by IGNOU MAAN, and our topic is Methods and Techniques in Health Studies. Methods are ways of studying people from an anthropological perspective. There are the various approaches anthropologists take to learn about a given people or culture. They include such general things as participant observation, a key method of studying in socio-cultural anthropology, as well as including more specific things such as survey research, archival research, and more. Here we need to remember that whatever the area of focus, anthropologists generally use the same research technique. Lambert et al. 2002. Medical anthropology utilizes all methods that are also used in other areas of socio-cultural anthropology. For example, participant observation or different forms of interviews. However, these methods have to be adapted carefully to specific research topics of medical anthropology. For example, there may be general guidelines for the execution of an expert view, but in application there is a big difference whether the expert is a physician, an Ayurvedic doctor, or a self-trained homeopath. Other techniques and at times usually complex problems in medical anthropology research can be the access to healers and patients and the ethical dimensions of research about life and suffering. Applied anthropology methods are eclectic, ranging from qualitative to highly quantitative. Ethnographers have developed rapid assessment techniques to document community health needs during brief field trips. Others trained in public health, epidemiology, nursing, or medicine may do clinical or laboratory procedure or work with vital statistics. In quantitative approaches, rigorous attention is paid to sampling issues and sophisticated statistical analysis and informed consent procedures are followed. As Carol E. Hill, 1991, points out, many medical anthropologists are now working outside academia and combining standard anthropological skills and techniques, planning and evaluation skills. Participant observation. The classical research method in anthropology is participant observation. As defined by Malinowski, the investigator in the field has to integrate him or herself into an unknown cultural context, participating in everyday life of other human being only becomes possible by learning the foreign language. Participant observation thus involves a researcher or researchers living within a given culture for an extended period of time to take part in its daily life in all its richness and diversity. The anthropologist in such an approach tries to experience a culture from within as a person native to that culture might do. Researchers doing participant observation often take part in the daily life of the culture exist trying to exist in the culture as if they were born into it. This is probably the most frequently included, if not necessarily the most heavily utilized technique. Much depends on the interpretation of the researcher concerned, and so emphasis has been laid on the proper orientation of the researchers. Lambert et al. 2002. The ideal of anthropological field research is participant observation, where a disturbance of the observation situation should be avoided by the researcher. This is particularly valid for research about medical pluralism, indigenous perception of and behavior towards illness, and people's attitude towards the different therapeutic options. Reflection. The methodological implication of doing research on a stigmatized topic, which may be AIDS, acquired immunodeficiency syndrome, as well as any other stigmatized topic, illustrates the risks and benefits of qualitative research. The exploration of stigmatized and taboo topics has direct implication for the action and the position of the field research himself. The anthropologist becomes the bearer of the secrets, who is not only restricted by his role as a participant observer, but who, for ethical reasons, cannot make his knowledge public, even if decision to stay silent may lead to new infections and therefore to increase suffering. Even before beginning fieldwork, it is for these various reasons essential to reflect on the potential ethical dilemmas which may result from doing research on a stigmatized topic. Case study method. Nectar and Nectar, 1996, who takes an ethnomedical approach when investigating international help, proposes that the best way to approach the subject is to examine a number of individual case studies. They argued that each case study can shed light on specific issues including reproductive health, disease control, health education, and pharmaceutical use, etc. To illustrate their point, they studied women's reproductive health by examining women's health practices during pregnancy, fertility related practices, and interpretations of and demand for fertility control, 1996. By researching individual case Nectar and Nectar were able to investigate many diverse factors, both social and biological, that contribute to each of these issues. By studying about one illness or problem in many different cultures, we are able to understand about it from varied perspectives. It is sometimes thought that by taking away the cultural noise, we can reveal the true nature of the illness or problem outside its cultural context. An alternative view developed here is the causative factors, experiences, expressions, and consequences of physical or mental suffering may vary in different cultures. A complaint make no sense in a cultural vacuum because its meaning cannot be accurately communicated. A society's culture can be likened to an individual's memory. Health practitioners, while acknowledging the presence of certain outstanding personality dimensions across cultures, must therefore realize the need for understanding the interaction of collective and individual identity. Survey research. Survey research is a method in anthropological research that describes any techniques that involves asking respondent questions. The survey in the title can be an in-depth one-on-one interview or a short questionnaire. Anthropologists who use surveys frequently do so in combination with another method, and much has been written about respondents falsifying answers to questions. Nevertheless, the importance of this method in understanding the health situations of various communities cannot be denied. Lambert et al. 2002. Cross-cultural comparisons. Cross-cultural comparisons are just what they sound like, a research technique that compares one culture with another or several others. These comparisons can be comprehensive or focus on a specific element of a culture's practices. These comparisons grew out of an attempt to document the similarities rather than differences among cultures, and to hypnotize and to hypothesize probable cause of human behavior beyond explanations deemed cultural, ethnic, or environmental. Practicing anthropologists can use cross-cultural comparisons methodologies to compare field data or case studies from a wide variety of cultural groups in attempts to gain a greater understanding of the health status of humanity as a whole. This method is sometimes called worldwide cross-cultural analysis. Researchers conducting health studies can also instigate a controlled comparison among a set number of cultural groups that have some element in common to try and gain a deeper understanding of that element and the people it impacts. Lambert et al. 2002. Documentation. Practicing anthropologists can use this cross-cultural approach in the related techniques of media analysis, archival research, and historical analysis. These are all terms that describe applying cross-cultural inquiries to written documents. The documents could be directly from the culture being studied, from documents studying particular cultures, or documents created in response to second-hand studies of a culture. Presently, these terms go beyond written documents to include digital representations. We can well understand the importance of this method in health studies. Lambert et al. 2002. Roles of practicing anthropologists and contributions of anthropology to health. Applied medical anthropology is strongly interdisciplinary in its nature and approach. Medical anthropologists often work with academics in the field of sociology, medical psychology, and demography. Applied medical anthropology brings with it anthropology's comparative framework, which helps medically trained people avoid a limited one culture perspective to see how social and environmental factors affect health and to be aware of alternative ways of understanding and treating disease. Kotek 2002, Scooping and Decourse 1995, Howard and Dunef Hattis 1992 and Brown 1993. In general, medical anthropologists play two important roles. First, that is, they work in collaboration with health and other professionals and researchers as consultants, advisors, and researchers, and they are involved in independent research for advancement of anthropological knowledge. Kotek 1994, Scooping and D Course 1995, Han 1999. Some of the specific applications or contributions of practicing anthropology in the field of health and illness include helping hospitals and health agencies to deliver health care more efficiently or effectively to the people, helping the national and international health organizations by providing anthropological data on the culture of peoples of the world, and working with epidemiologists in identifying the effects of cultural practices and beliefs on the transmission of disease, and assisting health professionals in the area of disease prevention and control. Their contribution in the field of general health education, efforts relating to family planning, maternal and child health, improving community sanitation, and nutritional counseling has helped immensely in enhancing community participation in disease prevention. The publication of Flippy Borgios and Jeff Schonberg's book Photois Ethnography, Righteous Dauphiend, part of University of California series in public anthropology, makes a case for critically applied public anthropology through its focus on the unintended consequences of public policies that inadvertently ex- exacerbate the suffering of street-based drug users in the United States. Brondo 2010. The work was on exhibit at the Slout Foundation of Philadelphia from December 3 to 31st, 2009, and University of Pennsylvania Archaeology and Anthropology Museum from December 5 through May 2010. The exhibition was designed as a public conversation in conjunction with the Penn Center for Public Health Initiatives 2009-10 series, Creative Action, the Arts in Public Health. Policy recommendations that emerged from their research include the expansion of single-room occupancy hotels with in-house medical staffs, mobile health clinics and methadone clinics, and better case management for emergency room frequent flyers. Brondo 2010. At the last, we will discuss the summary. As we have noted, health is a multidimensional state. It can be broken down not just into physical, mental, and social domains, but also into further subdivisions within each of these. We can at once be relatively healthy in some aspect of life and relatively unhealthy in other aspect of it. There is no clear line that we cross to move from an unhealthy category into a healthy category. People and their health are more complicated than that. In the Alma Ata Declaration of 1978, the WHO World Health Organization put greater emphasis on the social dimension of health by focusing on primary health care. This declaration stated that resources were too concentrated in centralized, professionally dominated, high tech institutions, especially hospitals. Instead, it emphasized the importance of community participation in healthcare and the importance of communities having some ownership over their health services. In focusing on the primacy of the community, this declaration allowed for the incorporation of community values. Different communities have different values. These differences often reflect different cultures or subcultures. Thus, the movement towards community health also offered a mechanism for integrating cultural values into healthcare. Perhaps the clearest integration of the culture into a community focused definition of health is the following, adopted by Health and Welfare Canada, cited in Kazarian and Evans 2001, a resource which gives people the opportunity to manage and even change their surroundings, a basic and dynamic force in our lives, influenced by our circumstances, our beliefs, our culture, and our social, economic, and physical environment. Qualitative methods are now common in research into the social and cultural dimensions of ill health and healthcare. Anthropology as an applied science, when utilized in health issues, is related most commonly to the biological, social, and cultural dimensions of health, ill health, and medicine. In short, applied medical anthropology or practicing anthropology of health requires the combined expertise of a medical professionals, a social worker, and an anthropologist. Satisfaction in work is immense for practicing anthropologists working in areas related to health, as it can contribute to understand and solve health problems and their origin in their totality. Practicing anthropologists are in great demand in the developing countries of Africa and Asia, who can guide their governments in creating a sustainable, holistic, and effective healthcare program. The breadth and reach of practicing anthropologist in 2009 suggests that anthropology has entered a new phase of advanced engagement at local, national, and international levels. Anthropologists here were active in bringing to light long standing issues of health disparities and global health related human rights violations, as well as in providing recommendations for national and community level policy initiatives in the wake of this renewed public interest. Brondo 2010. Thank you very much.